Have you ever thought about what happens, like long-term financially, if you're a federal employee and you get hurt on the job? Permanently hurt. We're not just talking about, the time off you take right after it happens. Think about maybe a shoulder injury that just never feels quite right again. Or maybe a knee issue after surgery that limits what you can do. It's more than just the immediate pain. There's this lasting physical change. It affects your life, maybe even how you earn a living. So, how does the system actually account for that permanent functional loss? That's what we're diving into today. Our mission here is to kind of cut through the jargon and complexity around something called schedule awards and these impairment ratings.
Yeah.
Think of this as your shortcut to understanding a really specific but honestly super important part of federal benefits. It's all about how permanent physical losses get compensated, why these specialized medical evaluations are so critical, and, well, how you actually navigate the whole process.
Yeah, and it's crucial to understand right off the bat that this isn't just made-up stuff. There are very specific rules and guidelines. We're talking about the Federal Employees Compensation Act, everyone just calls it FECA, and the detailed regs from the U.S. Department of Labor, the DOL. These are the official sources, the rule books, that govern how this whole compensation system for permanent partial impairments works for federal workers.
Okay, so let's unpack that term, schedule award. What exactly is that? Sounds kind of official.
It is, yeah. It's literally from a schedule in the law. Basically, a schedule award is compensation for federal employees who have a permanent partial impairment. And it has to be to certain specific body parts listed in the FECA schedule. Mostly we're talking arms, legs, hands, feet, eyes, hearing, extremities, and functions. The law sets a maximum number of weeks of compensation for a 100% loss of use for each part. So, for example, losing total function of an arm is worth 312 weeks. A leg is 288 weeks. A hand, 244 weeks. A foot, 205 weeks, stuff like that. The way the award is figured out is pretty straightforward, actually. You take the percentage of permanent impairment for that body part, which a doctor determines, and you multiply that by the maximum weeks for that part. So let's say you injure your leg and the doctor finds you have a 10% permanent impairment. You'd be entitled to 10% of the 288 weeks for a leg. That works out to 28.8 weeks of compensation.
Okay. And here's where it gets really interesting, right? This is about the permanent functional loss, not just the wages lost while recovering.
Exactly. That's a critical distinction.
So someone could technically go back to work, maybe even full duty, but still get this award because, say, their hand just doesn't work like it used to.
Precisely. The award is for the physical impairment itself, the loss of function, totally separate from wage loss benefits you might get while you're out. And an important little nuance here. The back, the spine itself, it's not on that schedule in FECA.
Oh, really? So a back injury alone doesn't qualify?
Not directly for a schedule award, no. But, and this is key, if that back injury causes permanent impairment in a limb, like nerve damage causing weakness or numbness in your arm or leg, then that limb, the arm or the leg, can be rated, and you can get a schedule award for the impairment to the limb caused by the back injury.
Got it. That makes sense. Okay, so timing. When can you actually get this impairment rating done? I imagine you can't just get it right away.
Yeah.
You mentioned something about maximum medical improvement, MMI.
MMI, yes. Absolutely fundamental. Maximum medical improvement. It basically means you've reached a plateau in your recovery. Your condition has stabilized, and the doctors don't expect it to get significantly better with more treatment. You're, well, as recovered as you're likely going to get.
Okay.
And you can only get a schedule award after you've reached MMI, because only then is any remaining loss of function considered permanent. The DOL needs medical proof, solid evidence that you're at MMI and have a permanent impairment. Usually, your treating doctor will document this when active treatment, like physical therapy, ends, and they figure more treatment won't really change the outcome.
Yeah, but what happens if someone tries to jump the gun? Like, they get the rating done before they've really hit that MMI point.
Yeah.
Is that a problem?
Oh, it's a huge problem, a really big mistake. If MMI hasn't been reached, if you're still improving, any rating done is basically invalid for the purpose of a schedule award. The DOL will just reject it. So you'd go through the whole process, maybe even pay for an evaluation, and it would be completely useless for your claim. You have to wait for that medical stability.
Okay, crystal clear. Wait for MMI. So once MMI is reached, how did the doctors actually figure out that percentage? Is there like a standard method, a rule book?
There absolutely is, a very specific one. Doctors have to use the AMA guides to the evaluation of permanent impairment. It's a big, detailed medical reference book. But here's the crucial part for federal employees, the part you absolutely cannot miss. OWCP, that's the Office of Workers' Comp Programs, they mandate using the 6th edition. the latest one. This applies to any impairment evaluations done on or after May 1st, 2009. I really need to stress this. Any federal impairment rating must use the AMA Guide 6th edition, period. If a doctor uses an older one, like the 5th edition or the 4th, OWCP will not accept it. Your claim for a schedule award based on that rating will just be denied.
Okay, 6th edition, got it. Why does that specific edition matter so much, though? What's different about it compared to the older ones? Does it change the outcome?
It does, yeah. It matters a lot. The 6th edition uses what's called a diagnosis-based, evidence-based approach. It's designed to be more consistent, more objective, and fairer. So the doctor identifies your specific diagnosis, like, say, a rotator cuff tear with specific findings, or a certain type of knee ligament injury. They determine its severity class based on objective criteria in the guides. Then they use standardized tables and specific criteria within the 6th edition to assign the impairment percentage for that body part. They also factor in things like range of motion, strength, specific functional testing results.
So it's less subjective, maybe.
Exactly. It aims to be much more objective and evidence-based. The practical implication is huge. Using the wrong edition, or even using the right edition incorrectly, can seriously delay or even kill your claim. The 6th edition reflects the current medical understanding, and honestly, it's a very specialized type of evaluation. Your average family doctor, or even some specialists, might not be familiar with the detailed methodology of the 6th edition. It takes specific training. That's why it's so important to get the rating done by a physician who is specifically trained and certified in using the AMA Guide 6th edition for impairment rating.
Okay, that makes perfect sense.
Yeah.
So we know what it is, when you can get it after MMI, and how the percentage is figured out. AMA Guide 6th edition by a certified doc. But let's talk brass tacks. What does this mean in terms of actual money? How did these percentages turn into dollars for someone listening?
Right. So the formula itself is pretty clear. Your schedule award is the impairment percentage times the maximum weeks for that body part times your weekly compensation rate. We already talked about the maximum weeks, 312 for an arm, 288 for a leg, etc. That's set by the law, by FECA. Your weekly compensation rate, that's usually 2/3, 66.7% of your average weekly wage if you have no dependents, or 75% if you do have dependents. That wage is typically based on your pay rate at the time you got injured or when the disability began, and there are maximum limits set by FECA too.
Okay, let's make it real. Can we run through a couple of examples? I think that really helps people grasp the potential impact.
Sure, absolutely. Let's take a shoulder injury. Say a federal worker has a chronic shoulder problem from work, reaches MMI, and a certified 6th edition rater determines they have a 20% permanent impairment of the arm. Okay, so the arm is 312 weeks max. 20% of 312 weeks is 62.4 weeks. Now let's say their weekly compensation rate, the 66.7% or 75% of their pay, is $1,000 a week. You multiply 62.4 weeks by $1,000. That's an award of roughly $62,400.
Wow, okay, that's significant. And how is that paid out? All at once?
It's typically paid out over that number of weeks, so 62.4 weeks in this case. However, you can request a lump sum payment, and OWCP might approve it, especially if it's considered in your best interest. Let's do another one, knee injury, common one. Say it results in a 10% permanent impairment of the leg after MMI. The leg is 288 weeks max. 10% of 288 is 28.8 weeks. Again, if the weekly comp rate is $1,000, that's an award of about $28,800. So even what sounds like a lower percentage, like 10%, can still mean a substantial award because it reflects a permanent loss. And obviously for more severe injuries, say 50% impairment of a leg. That's 144 weeks. If the comp rate was maybe $700 a week, you're looking at over $100,000. I saw a published example where someone had a 42% leg impairment. Their comp rate was $750 a week, and the award came out to around $90,720.
It's really clear then. The higher the impairment rating or the higher your salary was, the bigger the potential award. It really is a way to provide some financial cushion for that lasting physical change.
It really is, and it makes a difference. We've heard directly from people like there was a letter carrier who had a total knee replacement. He mentioned how getting that schedule award really helped his family and him while he was recovering and adjusting. It underscores why getting an accurate evaluation done correctly is just so vital.
Absolutely.
And one more time, just to be super clear, this schedule award, it's separate from your regular wage loss disability pay. You generally can't get both at the same time for the same injury. This award is for the physical loss of function itself. It doesn't matter if you missed workdays or not, though usually you have. And crucially, accepting a schedule award does not mean OWCP stops paying for your medical treatment for that condition. They still cover necessary medical care related to the injury.
Okay, that's a relief.
Big
Good to
deal.
know.
Yeah.
But wow, this whole process, it sounds incredibly detailed, very technical, lots of specific rules. What's the biggest hurdle for injured federal employees trying to navigate all this? And how do you find the right kind of help?
You hit the nail on the head. The biggest challenge, honestly, is dealing with the OWCP system itself, the bureaucracy. Knowing which forms to use, understanding the specific rules, getting all the right documentation together, it can be completely overwhelming, especially when you're already dealing with an injury.
I can imagine.
And that's where having specialized expertise is just invaluable. You really need a doctor who isn't just good medically, but who truly understands the federal workers' comp system inside and out. Someone like, for example, Dr. Kendra Pearson. She's a doctor of chiropractic, but crucially, she's certified as a 6th edition impairment rater. She specializes specifically in federal work injuries, making sure those ratings are done exactly by the book according to OWCP standards, even handling complex stuff like whole person impairment.
And you mentioned she has quite a bit of experience, right? Over 2 decades. Plus, that personal connection, her husband being a former letter carrier, that must give her a unique perspective.
It absolutely does. It adds a real depth of understanding and commitment, I think. And it's not just about the rating itself. Clinics that specialize in this, like HERS Restore Muscle and Joint Federal Injury Centers in Kansas City and St. Louis, they offer much more comprehensive support. They really guide patients through the entire OWCP process, from helping file the initial injury claim forms like the CA1 or CA2 to getting second opinions if needed, right through to completing that final schedule award impairment rating. They know the OWCP regulations, the potential pitfalls, and how to make sure everything is documented correctly to avoid delays or denials. It's about preventing missteps.
That sounds incredibly helpful. But given how specialized these certified 6th edition raters are they easy to find? What if someone listening isn't near Kansas City or St. Louis?
Yeah, that's actually a significant hurdle for a lot of federal employees across the country. Finding a local doctor who is both qualified and willing to do these specific federal impairment readings using the 6th edition, it can be surprisingly tough. Many treating physicians just don't have the specific training, or maybe they're just not comfortable with how detailed and time-consuming the process is.
They're pretty scarce.
Relatively scarce, yes. Which means federal employees often find themselves needing to travel to get a proper evaluation done by someone certified and experienced. That's why some clinics, like Dr. Pearson's, have really recognized this need and set themselves up to help people from all over. They welcome patients from literally anywhere in the U.S. People fly into Kansas City. The clinic is conveniently like 7 minutes from the airport, often just for a same-day exam. The clinic helps coordinate things to make it as efficient as possible. This kind of national service really addresses that gap, ensuring people can access the expertise they need for an accurate rating, regardless of where they live.
Okay, so let's wrap this up. What's the bottom line for you, the listener? If you're a federal employee and you've suffered a permanent work-related injury, getting that proper 6th edition impairment rating done after you reach maximum medical improvement seems like it's the absolute key, right? It's the linchpin to turning that permanent injury into the actual compensation you're entitled to.
That's exactly it. It's the critical step. And having the right specialist, someone who knows the ropes of OWCP, guiding you through it all, that brings peace of mind. It's knowing your impairment has been assessed accurately, using the right standards, and that all the I's are dotted and crossed for the Department of Labor to process your schedule award correctly.
This whole system, it really puts a tangible value on the lasting impact of these injuries. It's compensating for that loss of function, not just lost work time. Kind of makes you think, doesn't it? How do we as a society really acknowledge and support people who've dedicated years to federal service and now have to live with permanent physical changes? And maybe more personally, for anyone in that situation, it just highlights how incredibly crucial it is to be informed, to be proactive, and to make sure you get what you truly deserve under the system.